Hi, this is Dr. Paul Chasan at Ranch and Coast Plastic Surgery. I was asked, what's like the most unique surgery you've done? You know, and God, we do so many unusual surgeries. I'm kind of a surgical adventurist, so I always take on like interesting cases. I'll kind of show a few cases that I think are somewhat interesting. This is a lady who was a nurse, and she had her nose done years ago, and it just doesn't look good at all. You can see that nostrils arch and this thing hangs down. I mean, it's really noticeable from a mile away. And we revised her nose, and I had to use rib grafts. Like, see this nostril up like that? This is taking cartilage from here and using rib grafting to bridge this gap and push the skin down. I think now she looks great. I mean, her whole life, her nose was kind of like part of her personality of a bad nose. That was quite an interesting reconstructive nose. Another nose that I remember that was kind of a tougher nose and required some of the advanced skill sets that, you know, after doing 3,000 plus noses, is here. Another one where she had her nose done, believe it or not, she had her nose done. If you paid money to have your nose and that's what it looked like, you'd be pretty bummed. Her nose was too big for her face, removed some cartilage here and here, but then put her own cartilage to push down that rim. So look how much prettier she is. I mean, look how she's noticeably a pretty girl, but all you really was seeing is her nostrils. So another interesting case that was kind of out of the box type case, and that's where my sweet spot is. You know, there are surgeries that fit all these boxes: breast reduction, tummy tuck, facelift, and then there's the out of the box ones, and that's where I think I thrive. This is a lady around 60 who had hip surgery. She has these depressions from her hip surgery. She wanted to have some volume to see how the buttock is really flat there. And just by doing fat, I didn't think I could get the projection and volume. And so what you did is a composite or combination of buttock implant with a silicone implant, liposuction, and fat transfer. And so what we were able to do through incisions down hidden in the buttock, I was able to put a buttock implant, release the scar tissue, and add fat to here. So now when you look at her, you can really see the hip indents have been improved. You see the buttock hollowness here. Look how nice her buttock is. And now when you see the scar looks like much, much better. And then also the side benefit, she had all this loose skin on the bottom of her butt. Look how that's been taken up. You know, when you come with these out-of-the-box solutions and you create something for someone that, you know, just is making it up, and then they have this fantastic result because you're not thinking like just straight inside the box, it really is fulfilling for me.